The red digits over the nurse's station read 2147. Fluorescent lights hummed with a faint tremor, a pale ribbon of glare along the waxed floor. Chlorhexidine hung in the air sharp and medicinal. Somewhere down the corridor, a monitor kept time with 2 soft beeps between breaths. Riley Shaw tugged her mask under her chin and rubbed the heel of her palm along a stubborn crease in the fabric, a small ritual before a long night. St. Michael Trauma Center sat 10 minutes from Joint Base San Antonio, close enough that uniforms mixed with hoodies in the waiting room. Tonight, the halls carried the low thrum of machines and the scuff of sneakers. Riley moved through that noise with a deliberate economy, like she had learned to slot her steps into the gaps between sounds. She kept her eyes on the charts in her hands. She kept her left wrist turned in the cuff of her scrub top, tugged low, where a strip of black fabric peeked out like a shadow. Dr. Leonard Pierce was at the glass wall outside Trauma 2. Arms folded, jaw cut clean by habit. He looked up when she approached, and the glance he gave her was quick and measuring. Years of running this floor had given him a way of speaking that felt like a verdict. He tapped the whiteboard with a capped marker. "Appy for bed 11? Keep it simple, Shaw." Her nod was small. "I will." "First year," he said, and the words fell cool. "You watch vitals. You do not improvise." "Understood." Jordan Park slid behind the desk, collecting wristbands, a pen tucked into her hair. She watched Riley slip a glove on to turn a page. The strip of black fabric flashed again, stitched with a faded outline of wings. Jordan squinted without thinking. "Brace," Riley said, and pulled the cuff lower. Jordan murmured half a note, then to business. "Bed 11 is the soldier from Lackland, mild fever. Pain migrated from periumbilical to right lower quadrant. Labs are in. CT reads as uncomplicated. He says he is fine. He smells like mess hall coffee." Riley cracked the chart. White count elevated, CRP up, lactate a little high, no free air. CT axial slice showed the appendix swollen and dark along the tip. She paused at a secondary note. Bowel gas pattern uneven. A small pool by the pelvis that could be fluid or artifact. Her finger hovered over the numbers again. Bed 11 was young with a crew cut and a t-shirt that had once been white. He tried to sit up when she entered, then settled with a hiss of breath. He grinned like this was a drill and he had done worse. "Specialist John Rivera," he said. The grin faltered when his abdomen cramped and went hard under her fingers. "How long specialist?" "Since this afternoon." "I kept thinking it was something I ate. Then the pain started to punch." He tried to laugh. "I have PT in the morning." She listened to bowel sounds. She watched his face for the flicker that came before a flinch. Guarding. Rebound that was subtle and too quick. She thought of the irregular pool in the pelvis, and of the way breath lines tremble when something inside is starting to leak. She finished the exam and stepped back. "We will take care of you," she said. "No jokes now." He nodded. In the alcove outside, Riley found Pierce and set the chart down without a scrape. "Labs are trending more aggressive than the imaging suggests," she said. "His belly is starting to guard. There is likely early peritonitis. We should prep broader antibiotics and be ready for more than a straight appy." Pierce flicked through the pages with one finger. "Vitals are within tolerance. CT is routine. You are reading spooks where there are shadows." His words were clinical, but she saw the pinch near his eye. He was more irritated at the suggestion than at the risk. A resident behind him shifted, eager and watchful. "I would like to have suction ready for contaminated fluid," she said, "and I want near-far sutures on hand to anchor if the tissue is friable. I will keep it clean. But I am not going in blind." He capped the marker again. "Gear your tray," he said. "If you find trouble, you call. No heroics." Riley allowed herself one breath. "No heroics," she said. In OR3. The light hung like a white sun over stainless steel. Priya Natarajan adjusted the ventilator settings with neat, exact fingers, her eyes calm behind fogless lenses. Her voice carried low and even over the small noise of the room. "I like your prep notes," she said, not looking up. "You want dual suction lines? One will do. I will start lateral to McBurney. If the tissue looks angry, I will widen early. I want the small Richardson out first." Priya nodded and reached for the tray list. Jordan stepped in to confirm the patient and the site. Her glance skimmed Riley's left wrist again and lingered a fraction longer. Riley held out her arm for the timeout. The black fabric brushed the inside of her glove. Warm, familiar. She did not move it. Miguel Torres wheeled in a crash cart they did not need yet. He whistled once between his teeth and then quit when Priya looked at him. His eyes slid to Riley and caught on the pyramids of sterile packs she had stacked with corners facing the same way. Recognition skated across his face and vanished. Rivera arrived pale but polite, trying not to look scared. The mask helped. He answered questions signed where he needed to sign. When the anesthetic hand settled a mask over his face, he stopped trying to be funny and let himself float away. His chest rose slow and steady under the blue drape. The monitor picked out a rhythm like it had practiced for this exact patient. "Knife," Riley said. The word was soft, but the scrub nurse put the blade in her hand without a sound. Skin gave way under the steel. She felt the slight drag and then the clean slide layer by layer, the body opening in the place it needed to open. The air smelled faintly of cautery before anyone asked for it. She used a small retractor to let the belly wall drift back and reveal the work. "Small Richardson," she said. The instrument fit her hand like it belonged there. She traced the line of tissue with the tip patient and precise. The appendix nestled under a film of inflamed peritoneum that looked more sullen than a simple case should. She did not look up when she asked for suction. When the tube handed over, she hovered it until a small pool shivered and climbed the lumen. Cloudy, not yet dirty, but headed that way. "Antibiotics are in," Priya said. "Thank you." A resident in the gallery leaned forward and whispered something to another, the glass making the sound a moth wing. Riley set the meso appendix apart from what wanted to stick where it should not. Her hands did not tremble. Her hands remembered something older than this room. She placed clamps with space for tissue to swell without bruising itself. When she began the suture, she used near far bites that distributed tension where edges would be stressed. The pattern looked strange inside a quiet civilian OR. It looked like strength sewn into places that might have to take a hit. Jordan watched in a different silence. She did not have the vocabulary for every stitch, but she understood economy and she understood when fear changes the way a person breathes. Riley was not afraid. She was attentive. It felt like the difference between a person who hopes and a person who expects. Riley checked the cavity one last time and irrigated in small circles until the return ran clear. She closed in layers with a music to the turn of her wrist. Priya recited vitals without drama. The room settled on the soft sound of the monitor and the tumble of suction water in the bottle. The red digits outside the OR now read Gitu47. The corridor had quieted by a degree, the hospital taking a slow breath. Riley stripped off the outer set of gloves and let them fall into the bin. She pressed her knuckles against the side of her neck, where a knot lived when the air was too dry. She looked through the glass at the hallway, a long corridor full of doorways. Each threshold was a line on a map between one duty and another. Pierce stood in the doorway before she could step fully into the hall. He took in her face and the OR behind her. He did not ask for a detailed report. He wrote quick notes with the marker on the whiteboard. "You found contamination," he said. "Tell me you handled it." "I handled it." His eyes flicked briefly to her wrist. He did not comment. He capped the marker and tapped the board once. "Good. Keep your focus." She thought about telling him that focus was not something she could misplace. She did not say it. She moved past him toward the scrub sink, then toward the bay where Rivera would blink awake under a thin blanket. Her steps were steady. The hallway smelled faintly of rain through vents no one ever saw. The intercom clicked. Static scraped a line through the quiet. A voice from dispatch came in clear and costed. "Mass casualty inbound. Multiple casualties. Possible IED on loop 410. All available trauma teams to stand by." The monitor at the nurse's station skipped a beat, then found it again. The red digits flickered and held. Jordan looked up from a stack of admission labels. Priya was already turning toward supply. Pierce had a hand on the whiteboard and did not move it. Miguel reached for his radio without looking at it. Riley stood with one foot in the light and one in the shadow of the door frame. The black fabric at her wrist warmed against her skin. She listened to the second announcement. She placed her chart on the counter and rolled her shoulders once to settle them where they belonged. "Ready," she said, and her voice was quiet. The hall answered with a horn in the rain. The first siren reached the bay like a blade of sound pulled through rain. The automatic doors slid wide. Air rushed in damp and metallic, carrying the smell of wet asphalt and diesel. Jordan clipped a fresh badge reel to her pocket and called out arrivals to the whiteboard. Priya covered her hair eyes already moving through a quiet checklist. Pierce planted himself at the junction of hallway and pit, where every stretcher would pass within arm's reach. Gurneys rolled in 2 by 2. A medic shouted vitals blanketed by ponchos. Another yelled over the rattle of wheels. Male early 20s blast injuries to lower extremities, pulses thready. Female 30s closed head injury, unequal pupils. Teenager possible internal bleed, tachycardic pressure dropping. The sound stacked until it hit the ceiling and thinned out along the tiles. Riley stepped into the slipstream. She pressed gloves into hands and steadied a rolling IV pole that wanted to tip. The black fabric at her wrist warmed again tight as a reminder. She watched a young nurse freeze for half a breath and guided her left hand to the correct clamp. She did not raise her voice. The nurse found the clamp and fleshed a line without spilling a drop. Pierce carved the chaos into lanes. Trauma 1 open thoracotomy, trauma 2. Head injury call neurosurge now. Trauma 3 chest tube and blood. Junior residents hovered until he pointed. He did not point at Riley until the third wave of stretchers. He slid a file into her palm as if he were handing off a clipboard in a conference room. Least acute, he said. Keep the traffic moving. She looked down at the face on the stretcher. A boy with dark curls and a bracelet of cheap beads' eyes glazed by pain. His shirt was cut away. The abdomen rose shallow and uneven. His breath sounded wet on the right. She set the file on his thigh and pressed her fingers to his rib cage. The space between beats felt like a question. Needle decompression right side, she told the nurse. Now. The nurse glanced at Pierce. He was already writing a name on the board. Riley took the kit herself and found the mark by feel. The needle went through with a soft resistance and then a rush. The boy coughed and dragged a breath that did not sound like drowning. She nodded once to the nurse and moved the stretcher to a bay where the light was better. Miguel Torres pushed another gurney past her and dipped his chin without stopping. He had rain in his eyebrows. He called out male mid-30s seatbelt sign, hypotensive possible spleen injury. Riley did not answer him. She watched the way his hand stayed on the shoulder of his patient for a half-second, after he let go a reflex that keeps someone from falling out of a moving truck. A reflex you do not learn in a classroom. Jordan touched Riley's elbow. Blood bank says O negative is tight. They are spinning more. She lowered her voice. They can set up a volunteer pool if we want walking donors. We would need Pierce. Riley looked at the line of stretchers. She looked at the rain trying to push itself through the open doors. She could feel the clock on the wall without looking at it. Her eyes went to Pierce. He was speaking to a senior surgeon, arrows and initials laid down on the whiteboard like a battle plan that refused to hold. We should prep for a walking donor pool, she said when she reached him. Screen the staff and any cleared soldiers in the waiting area. It will cover the gap if the first cooler runs dry. This is a hospital, he said. We draw from the bank. Banks run out, she said. Her tone did not rise. This buys time. We are not a forward surgical team. No, she said, but blood still saves people. He looked at her for a breath. The marker made a hollow sound when it met the board. He did not say yes. He did not say no. He wrote an extra arrow toward the lab and reached for the phone. A crash near the door snapped heads around. A stretcher caught on the threshold and jerked metal legs shrieking on tile. A medic cursed and rebalanced the weight. The patient on it groaned. Riley got there first. She caught the rail and pushed through with a steady shoulder against the frame. The medic spit rain and thanks in the same breath. IED on loop 410, he said. Buses, maybe cars. Hard to tell with the dark. There was this bright wave and then it ate everything. Riley's hands were already on the patient. He was pale beneath road grit. His abdomen felt hot, distended stone heavy under her fingers. A bruise bloomed like a map across his lower chest where a seatbelt had dug in. His pulse jumped and slipped. He blinked up at the ceiling and did not see it. She slid her hand higher and pressed lightly at the notch under his sternum. His breath hitched and stalled. Jordan called Priya 2-3, Riley said. I want ultrasound at bedside right now. Tell them to put a thoracostomy tray in here and keep it sterile. Jordan went and did not look back. The red digits above the station read 2312. They burned in the corner of Riley's sight. The monitors in the bays beat in different rhythms, a choir that would not sing together. Pierce appeared at the foot of the bed. What are you doing with him, Shaw? That one goes to 4 once 2 clears. He lifted the chart and frowned at the vital signs, then at the pressure that slid down a few points with the last breath. He will not wait for 2 to clear, Riley said. She did not move her hand. She kept it like a weight holding down a sheet in a wind. Priya swept in with the ultrasound. She tucked the probe into a gel packet and handed it to Riley, like she had seen her do this 100 times. Riley set the probe against skin and turned the screen so the image faced her. Fluid framed the heart in a dark envelope where there should have been clean movement. The right ventricle looked pinched, a thumbprint pressed into muscle. She moved the probe down to the belly and found a black crescent near the spleen that was not supposed to be there. He is bleeding in 2 places, she said, pericardial and belly. If we do not intervene, he will fold before the scanner warms up. Miguel hovered at the curtain. He had stopped moving for the first time since he walked through the doors. His eyes went from the screen to Riley's fingers on the probe, his mouth pressed thin like holding a word inside. Name, Riley asked. Ethan Morales, the medic at the head of the bed, answered. 32. He clawed at the seatbelt to pull his wife out first. She is stable. He is not. Riley handed the probe back. Priya, get the kit for a pericardial window ready, but do not open it. Jordan, call the lab. I want TXA in the line. Start warming blankets. To Pierce, I want a massive transfusion pack staged at the door if we get a line to hold. She paused just long enough to let the words settle. We can move if he catches up. Jordan had the phone on her shoulder and a pen in her teeth. Priya was already pulling a tray toward her with the heel of one hand, voice even with the lab. Miguel stepped backward then forward, caught between bringing in the next stretcher and staying where his eyes had landed. A resident brushed past and hissed a question at Pierce. She's taking over your bay. Pierce did not answer him. He looked at Riley's hands. He looked at the pattern formed by the tools Priya had lined up, not yet opened. You have 2 other bays ready for you, he said to Riley. Then give me a timer, she said. His pressure will not last. If we miss the window, there will be no decision to make. His jaw worked. Then he pointed to the clock with the back of his marker. 3 minutes. Not a breath more. She nodded. She leaned to Ethan's ear and spoke in a voice that did not need to be loud to reach him. Mr. Morales, I am Riley. Your heart has fluid outside it that is squeezing it too much. Your belly is bleeding. We are going to work in this room to take pressure off your heart. We will keep you with us. His eyes flickered. The skin at his temple fluttered as if wind had touched hair that was no longer dry. He tried to speak and failed. He swallowed and tried again. Do it. Riley lifted her head. Jordan slipped a bit of gauze into her palm. Riley did not wipe sweat. She placed the gauze on the drape where her fingers would find it without looking. Priya set the defibrillator pads on Ethan's chest and smoothed them down. The gel made a faint wet sound like a wave against a dock. Pierce moved back half a step and then stopped. He watched the line of Ethan's blood pressure hit a low plateau and hold there like a ledge that might crumble. The red digits over the station ticked forward. The echo of the first siren had faded into a general din. The rain could still be heard at the far edge of the ceiling, where the vents brought in scraps of outside. Miguel reached the curtain and pushed it aside with 2 fingers. He spoke without lifting his voice. Ma'am. Riley did not look at him. Her left hand found a scalpel handle and tested the weight that never changed. She was aware of the black fabric against her wrist, warmer now, almost alive in the heat of the room. He said again, quieter, Ma'am, you showed me how to find a vein in the dark on a road with dust instead of asphalt. In Anbar. I thought I was going to lose a kid, and you did not let me panic. Riley kept her eyes on the field. Her words were barely air. Bring me a second large bore line set. If they make you wait at the cabinet, cut the lock. Yes, he said, and left the curtain swinging. The clock slipped 1 minute. Priya murmured to Ethan about a deeper breath. The monitor skittered and then settled at a pace that made people in the room breathe with it. Jordan had a new bag of blood in her hand that she did not yet hang the plastic crinkling as she clenched it to keep from shaking. Her face was still. Her knuckles were not. A stretcher banged into the adjacent bay. Shouts rose and fell. Someone called for a chest tube. Someone else asked for a neurosurgeon to come down now. The noise wove itself between the beeps and the rain and the soft rasp of disposable fabric against plastic rails. Pierce lifted his eyes and saw the hallway full of doorways. He had stood here 1,000 nights and given orders like he was posting guards. It was not a fortress tonight. It could not be. He looked back at Ethan. He looked at Riley and saw that she was not looking back. The pressure waveform on the monitor dipped. The heart rate flicked up. Ethan's chest rose and paused. The sound in the room inhaled with it and waited. The second hand on the clock jumped. Jordan's thumb slid under the tab on the blood bag. Priya's fingers hovered over a syringe. Miguel reappeared with an armful of plastic and clamps and did not say a word. The monitor alarmed with a flat, steady tone that cut across every other sound. The line went straight and red. Priya said one word, her voice level, not loud. Asystole. Riley's hand did not lift from Ethan's chest. Her voice did not climb or ask. Give me 3 minutes, she said. Do not call it. The alarm held a single tone that flattened every voice in the bay. Priya's hand hovered over a syringe. Jordan's thumb was still caught under the tab on a unit of blood that had nowhere to go yet. Pierce lifted his chin, mouth open to speak. Not yet, Riley said. 3 minutes. Who do you think you are? Pierce said. It came out quiet. His eyes did not leave the monitor. Riley looked at him and then past him to the hall where the rain kept breathing through the vents. She felt the black fabric at her wrist warm against her pulse. Sloan Mercer, she said. Major United States Army Medical Corps, 3 tours, combat surgeon. She faced the team, not the glass. 700-plus battlefield cases. We work now. The room did not gasp. It shifted like a tent catching wind and standing taller. Priya turned to the crash cart and checked the defibrillator without another word. Jordan pulled a pen from her teeth and started 2 calls at once, lab and blood bank voice even and quick. Pierce did not move for a single heartbeat. Then he set the chart down and stepped back enough to give her the line of sight to the bed. Riley set her fingers at Ethan's throat and felt nothing except the stickiness of gel. She placed the ultrasound probe again just long enough to confirm the dark halo around the heart and the pooled black in the left flank. She lifted the probe away and gave it back to Priya. We are designating hot and warm zones, Riley said. Jordan taped the floor. Trauma 1 and 3 stay hot. 2 becomes a holding bay for scans and reassessments only. No overflow into halls. Miguel, I need screened walking donors from cleared staff and soldiers in the waiting area. Basic questions only. No time for forms. Pierce, call the lab and authorize a walking pool. We start massive transfusion protocol now. This is a civilian hospital, Pierce said. The words felt brittle in his mouth. Then we do it clean, Riley said. TXA on board. Calcium after the 2nd unit. Warmers on. Priya pads now. If his heart returns, we go to the belly next. If not, we open subxiphoid for a quick window. If it pours, we drain. If it does not, we reassess. Nobody leaves this bed until I say. Jordan's tape hissed as it hit tile. She dragged a bright line across the floor and set another at a right angle. Priya peeled the backing off 2 defibrillator pads and set them on Ethan's chest. The gel was cold and smelled faintly of mint. Ethan's skin did not flinch. His eyes were half-open lashes wet with rain someone else had brought in from outside. Miguel had the curtain half-open, phone already at his ear. He spoke to someone 2 corridors away and to Riley at the same time. I can get 6 cleared donors in 5 minutes. 10 and 10. I will keep them in the warm zone. Do it, she said. The monitor hummed with the flat line that meant a heart was not making noise. The red digits over the nurse's station ticked over the second hand, jumping like a small startled fish. Riley felt the room lean toward her. She set her hand on Ethan's sternum, not to compress, just to measure distance. She saw the way the bruise under the seatbelt mark had deepened to a wine color. Priya, draw up epinephrine, Riley said. Keep it ready. Jordan, open that unit. Pierce, call MTP upstairs and bring the first cooler down yourself. Move past anyone who gets in your way. Pierce did not argue. He left at a fast walk and took the corner without looking back. Riley breathed once and let the breath sit low. She picked up a scalpel and felt the weight that never changed. She placed the blade under Ethan's xiphoid and pressed until skin parted with a clean give. There was a small sound like silk tearing. The smell of iodine rose and then the thin iron of blood. She made the cut short and neat, just enough to find the space under the sternum. Priya handed her a small retractor and Riley held the edges apart with the calm of someone making room in a drawer. She did not rush. She did not slow. Jordan blotted sweat that had nothing to do with heat from Riley's brow with a corner of gauze. Ethan's chest was quiet under the pads. The tone kept singing. Miguel stood at the door again. 4 donors already, he said. 2 more coming. O positive and A positive. I can get an O negative from a cop in the lobby if we need one. Good, Riley said. Jordan, start the first. Priya, calcium after 2 units. Keep his core warm. If his pressure comes up, we pivot to the abdomen. If not, we commit here. Jordan hung the blood with hands that never shook around a coffee mug. They were steady now. She watched the line, the slow climb of red, and then she looked at Ethan's face. The beads on his wrist were plain and cheap. The plastic dug into skin that had been pale too long. Riley made a window into the pericardium, careful and small. When she opened it, a press of dark blood pushed out around her instrument and then eased. Priya had a suction ready. The first line went to the bottle with a soft sound like water finding a drain. The flat tone wavered a small hiccup, then steadied again. Riley widened the cut by a breath. More fluid slid out, and the heart moved under her hand in a way that felt like an animal waking. "There," Priya said. Quiet. Hope did not touch the word. Observation did. The waveform twitched and then refused to commit. Riley felt the black fabric against her wrist as if it had its own pulse. She thought of an engine that needs air. She thought of a gate that has to open and will not unless someone leans on it. "Charge to 200, Riley said. Clear the field." Priya's hands were exact. The unit hummed and the charge light came up. She glanced at Riley, and Riley lifted her fingers off Ethan's chest without losing contact with the room. Priya said clear, and the shock lifted Ethan off the table by a fraction of an inch. His body fell back with weight that sounded unbearable in a quiet room. The line stayed straight, a half beat. Another. Priya reset the charge and looked at the clock without seeming to move her head. Jordan kept the blood-moving eyes on the drip chamber, willing it down the tubing faster with attention alone. Pierce reappeared with a cooler and the lab tech behind him. He set the cooler on a cart and snapped the lid open. He did not try to take over the space. He handed Jordan a unit of plasma as if it were glass that would shatter if anyone rushed. Riley slid the suction a fraction deeper into the pericardial sac. More blood found the line with reluctant obedience. The heart moved again, not with rhythm, but with intention. The flat tone flickered. Priya lifted the paddles. Again Riley said, "Charge." Miguel stood with his back to the room, guarding the taped line Jordan had set on the floor. He held a list of names and blood types written on the back of a folded flyer. His lips moved as he counted under his breath. He did not look over his shoulder. He did not need to. Priya cleared the field. The second shock left the faint smell of singed hair. Riley felt the movement under her fingers change, not a jump, something like a shiver. The monitor caught it and tried to make sense. A stuttering blip struggled between two flat moments. The sound broke into two beeps, and then one, then nothing. "Epi," Priya said. "Give it," Riley said. Her voice stayed quiet. Her eyes stayed on the line. Her hand went back to the small window she had cut. The suction hissed. The bottle at the end of the line filled to a mark and then to another. Pierce looked up at the red digits on the wall. He did the math in his head without showing it on his face. He looked at Riley and saw that he was looking at someone who did not have room for him right now. Jordan took a breath and let it go through her teeth. Her hands were steady on the tubing, but her knees had that loose feeling that comes when a floor cannot be trusted. She set one foot a little wider and the feeling eased. Riley lifted her eyes to the monitor and then to Ethan's face. His mouth was slightly open. The beads on his wrist had slid down to the bed rail. The gel on his chest had cooled and looked like frost. "Charge again," she said. 200. "Clear." Priya said clear, and the paddles lifted. The shock snapped through Ethan's chest. His body rose a fraction and fell back with a dull weight that made the rails shiver. The line held flat. Riley did not blink. "Charge again," she said. 200. Priya's fingers moved. The unit hummed. Jordan checked the drip chamber and pushed a few stubborn drops through the filter with a quick flick. The cooler sat open on the cart. Plasma waited. Platelets waited. The room had no room for anything except the next right thing. "Clear," Priya said. The second shock struck. The smell of ozone bit at the back of the throat. For a breath, the monitor showed a ripple that could have been hope or artifact. Riley leaned the suction toward the window she had made. Dark blood slid to the bottle, less than before, but still too much. She felt the heart through the instrument like a small animal trapped in a burlap sack. "Come on," Jordan whispered, not a prayer. A breath wasted on the air. "Epinephrine," Priya said. She pushed the dose. The flush went in. Riley kept her hands where they were steady as the table. Miguel stepped through the curtain with two men in fatigues and a nurse from pediatrics who had her sleeves rolled to her elbows. He had a clipboard he did not need and a list in his head he would not forget. O positive, a positive O negative. He looked to Jordan. She nodded once without looking up. Jordan labeled tubes and pressed gauze to elbows with a touch that did not tremble now that the work had a path. She handed the first bags to the lab tech like they were glass birds. The tech ran. Pierce stood to the side with his hand on the IV pole. He was not holding it up. He was holding himself in place. His eyes cut to the red digits on the wall. They had swallowed 1 minute. They were chewing on the second. Riley widened the pericardial window by a whisper and more blood let go with reluctance. The heart slid against her instrument, not strong, not sure, but there. Priya angled the suction and caught what she could without collapsing anything that needed to hold its shape. The tube sang soft and low. "Squeeze him," Priya said. Jordan hung a second unit and checked the warmer. She pressed the bag with her palms slow and even, a rhythm that matched her own breath. Color crept along the tubing and into Ethan's arm. His skin did not notice yet. "Now," Priya said. The line twitched. It tried to remember a pattern. The tone shifted, rose, and stuttered, fell, and tried again. Riley did not speak. She watched the movement with the same attention she used on a needle passing through tissue that would tear if rushed. The heart kicked, once, then twice. A third time that was less a beat than a refusal to be still. "Sinus Brady," Priya said. Her finger tapped a number that was low but real. Presser standing by, Jordan said. "Give him a breath," Priya said. She ventilated with a measured squeeze, and the chest rose not high but higher than before. The first donor unit came back. The lab tech slid it onto the cart and ran again. Jordan primed the line and spiked it. The blood moved. The room changed, not louder. Sharper, as if every edge in the space had been honed and turned the same direction. Riley kept the window open just enough for drainage. The pericardial sac slackened where it had been tight as a fist. The heart found a pace that a machine could recognize. The tone gave way to beeps that had a shape. Priya tracked them, her face still, the corners of her eyes more alive. "Pressure is crawling," Priya said. 60s, 70s. "Give me a little more." "Calcium," Riley said. Jordan pushed the dose. Miguel handed her a fresh pack of flushes without being asked. He set the rest on the tray and did not crowd. The donors behind him sat on folding chairs. Their forearms were held straight by will and tape. A medic checked them with a tired smile she kept only for them. Pierce set a hand on the cooler and took a breath he must have been planning for an hour. He looked at Riley. He did not try to take the blade from her. He did not try to trade places. He asked with one steady line, "What do you need?" "A pathway to OR," Riley said. "We are not doing a belly here. Call house. Clear a room now. Tell CT to hold. We will not risk that trip." "Done," he said. He made the call himself. He did not let the operator put him on hold. Priya looked up at the monitor. The numbers had climbed out of the hole and were standing on the ledge. Not safe yet. Not falling. "We can move," she said. "We can," Riley said. She set a small drain in the window and secured it with 2 careful stitches. The knot laid down with a neat logic that pleased hands and eyes both. She rinsed the field with a small swirl to keep the edges clean. She did not close the skin, not now. "Ethan," she said, then realized he could not hear her. She said his name again anyway, low, as if telling a secret. "Ethan, we are taking the pressure off your heart. Stay with us." He did not answer. His eyelids trembled. The beads on his wrist were wet where the gel had touched them. The gurney bumped under a hand someone had placed too hard. Riley steadied it with her hip. She pressed gauze where the drain met skin. Jordan taped it neat and firm and left tabs she could pull if she had to. The doors to the OR hallway were ready. A nurse from upstairs waited with a cap on that had cartoon sharks hidden near the seam. She had a kind face and a voice that did not wobble when she said, "We are open." "Move," Riley said. They rolled. The wheels clattered at the threshold. Miguel had a palm on a rail again without thinking. Priya kept a hand on the bag and the circuit as if the line were a leash for a creature that might bolt. Pierce walked backward, clearing people from their path with a look that softened once the elevators took them. At the OR doors, Riley handed off with words that were clipped but complete. Pericardial drain in place, ongoing abdominal bleed, likely near the spleen, 2 units in, presser ready, TXA on board, warmers running, window clean. She met the charge nurse's eyes. "If he slides, we go straight to damage control and pack." Her voice felt like a knife fit to a sheath. The team upstairs took him and the doors closed. The hall behind it caught their reflection in a thin silver layer and let it go. Riley stood still for the length of a slow count. The room hummed inside her head like an echo of a machine she had turned off with a switch she could not see. The black fabric at her wrist felt cool again, damp where sweat had gone and now dried. Jordan touched her arm once, not to steady just because the body needs a point to find itself after a run. "He is not the last one," Jordan said. "I know," Riley said. They turned back toward the pit. The taped lines on the floor still glowed. Hot zone. Warm zone. The bay they had left behind was a nest of instruments waiting to be washed and counted. The bottle on the suction line held a measure of blood that looked smaller than the work it had demanded. A voice at their backs made them both stop. It was not loud. It carried. Shaw Pierce said. Riley looked over her shoulder. He stood by the whiteboard with the marker in his fist. His jaw did not look locked anymore. He had rain on one shoulder of his coat as if the night had touched him and left a mark. He said 2 words. The first was soft and formal. Doctor. The second was the name she had given the room when the clock had started eating time. Mercer. He held her eyes. He lowered the marker. He did not add anything that would cheapen the words. Riley nodded. She let the words land and stay where they fell. She looked to the board. New names had been added, new arrows drawn a cluster around 2 that she would not be part of. She took the next chart off the counter and let her hands find their way to the work. Miguel stepped up with a wipe in his hand and a grin that showed more relief than humor. He glanced at her wrist and then just above her shoulder. I have 6 more coming in, he said. Crash from the freeway, not the blast. A pile up in the rain. The way the lights were set, it looked like a lake in the road. We will keep lanes clean, Riley said. She lifted her chin at the taped lines. No bleed into the hall. Yes, Miguel said. He pocketed the wipe. He moved. Priya rejoined with a new set of gloves and a fresh calm. Her hair had escaped in one curl that she did not fix. She nodded toward the elevator where Ethan had gone. He will need you upstairs after the first steps. Then she angled her gaze to the pit. We need you here first. Here, Riley said. She meant it. She rolled her shoulders to put them back where they belonged. The knot at her neck receded by a degree. The rain kept its slow drum along the roof. The vents brought in a cool draft that lifted the edge of a curtain. Somewhere a monitor laughed out a rhythm that meant someone had pain, but breath enough to complain about it. Somewhere else a nurse said a name 3 times in a way that made the person answer on the 3rd call. Jordan set a clean tray. She set a new gown on top of it. She checked the tie with a deft touch and left it open where Riley could reach it. She did not speak. She did not need to. Riley washed her hands and watched the water run in clear sheets. She shook them once and reached for the towel. The fabric skated along her skin with a rasp that felt like being pulled back into her body. She dried her wrist last. The black cloth soaked a drop and held it. The intercom clicked. The dispatch voice came again, less strained than before and somehow harder. Ambulances inbound, 2 minutes, multiple traumas. Prepare trauma 1 and 3. Riley lifted the new gown. She slipped her arms in. She tied the neck with a small jerk to set it, then tied the waist with a bow that would come loose without a fight. She looked at the taped line on the floor that marked hot and warm. She stepped across. The doors opened to the rain, and the sound arrived like a thing with mass. A gurney cleared the threshold. Another hit the threshold and knew it could not afford to catch. The room leaned forward. Jordan called out vitals. Priya reached for the next set of pads. Miguel met the 3rd gurney and took 2 steps sideways to spare the 4th. Pierce raised a hand and 6 people moved without colliding. Riley put a hand to her wrist and felt a pulse that skittered. She set the other hand flat on a belly that was too tight. She looked up and saw the red digits on the wall. They were not kind, they were not cruel, they were what they were. 3 minutes, she said. Let us work. By morning the rain had thinned to a mist. The vents breathed cool air into the pit and lifted the smell of iodine and coffee. The red digits over the nurse's station turned past 6. The taped lines on the floor still held their sharp edges. Jordan peeled them up one by one and pressed them flat on a clipboard to save for later. Priya leaned against the counter with a paper cup and her eyes half closed, listening to a monitor settle a nervous rhythm into something a patient could live inside. Riley rinsed her hands at the scrub sink and watched the water run clear again. The black fabric at her wrist cooled. She rolled her shoulders and felt the knot under her hairline loosen by a single click. She reached for a towel and stood there with it for a long breath she had not taken all night. Pierce was waiting by the whiteboard. The marker was capped and still. He had written and rewritten until the plastic surface shone through the old names. He did not look at the board when she approached. He looked at her steady and without angle. Doctor, he said, then Mercer. He held her eyes, his jaw unclenched. Thank you. She nodded. The word stayed where it was. A knock came at the doorway to the staff room. A woman in a dark uniform stood there with a coat folded over her arm. The cloth had been out in the weather. You could smell it, wool and wet. A small pin at her collar caught the light when she moved her head. Major Mercer, she said. General Elaine Harper. May I? Riley stepped aside and the room felt smaller than precise. The general rested the coat on a chair and did not sit. She took a sealed envelope from an inner pocket and set it on the table between a bowl of stale candy and a stack of forms. "Khazar Gate," Harper said. Her voice was even. "This is the declassification. The intel was altered. Command knew the corridor was hot and sent you in anyway. You were set to fail." Riley did not touch the envelope. Her eyes moved once a small swing from the paper to the window where the day came in thin and clean. The black fabric warmed against her skin with no source. The sound in the room turned quiet in a way that had nothing to do with volume. "I carried it," Riley said. "You can set it down," Harper said. Riley let the breath go and did not chase it. Harper watched the breath leave and did not look away. "Your work here traveled fast," Harper said. "FEMA called. The Joint Staff called. We are building an integration strip between civilian trauma centers and military protocols. We want you to write it. We want it taught in places like this. We want your hands to become a sequence on a wall that anyone can reach for when the clock starts to eat." Riley looked at Jordan through the glass. Jordan was pinning a strip of tape to a clipboard, smoothing a wrinkle with her thumb. Miguel walked past with a donor list tucked into a pocket, his grin soft and private. Priya stood at a doorway and spoke to a nurse in a voice that could steady weather. 3 conditions, Riley said. Curriculum control, no interference. Mandatory mental health support for every trainee and staff member inside the program. Agreed, Harper said, without pause. Riley picked up the envelope and slid it into her scrub pocket. She lifted the coat and handed it back to the general. The wool held the shape of a shoulder. Harper took it and nodded once. The door clicked shut behind her and left the room full of the sound of the vents and a clock that had not hurried in years. 3 months later, the simulation lab looked different. The walls were still the same beige, but there were lines taped on the floor that showed hot and warm zones. A plastic chest rose and fell on a table under a bright light. A sheet on a cork board held numbers no one chanted out loud. Survival rates were better. Door-to-blood times were smaller. Someone had written a date at the bottom corner with a smiley face. A child would have drawn, then erased the face and left the date. Riley stood at the podium without a microphone. The residents watched her and stopped touching their pens. She showed them a video of a pericardial window that had gone right and then a clip of one that had not. She did not narrate a set of rules. She pressed her palm briefly to the plastic ribs and let the silence teach the shape of pressure. After class, a young woman in scrubs waited until the room emptied. She had a haircut that someone had given her in a bathroom with bad scissors. Her voice held onto the doorway like a hand holds on a ladder. "I was Army," she said. "I keep thinking I should not say it out loud." Riley put a small card in her pocket. The card had a room number and hours. The chairs inside were soft, and the lights were the warm kind. Riley did not tell her what to do. She reached and adjusted the edge of the young woman's badge until it lay flat and did not catch. A photograph waited on Riley's desk when she came back down. Ethan Morales smiling. His daughter sat on his knees with their hair tied up 2 pieces of ribbon the same color. A note under the photo was a single line in plain black ink. "Thank you for not giving up." Riley pinned the picture next to an old clock someone had taken down during a renovation and left in the staff room. The clock did not work. Its hands pointed at a bad hour. The frame reflected light that made a bright nick in the glass. The photo sat a finger width away. The pick called from down the hall. Wheels rolled. A door opened. The vents brought in a breath of heat that lifted the paper edges on the bulletin board. Jordan called from the station. Priya answered without raising her voice. Miguel laughed once and then cut it off to listen to a set of vitals. Pierce stood in the doorway long enough to watch everyone turn into their places. Riley stepped into the corridor. She pulled the black fabric at her wrist a fraction tighter. The red digits above the station were not kind or cruel. They told the truth. The automatic door slid open on weather that could not decide what it wanted to be. A stretcher crossed the threshold and found the light. Riley touched a wrist. She set a palm where a belly was too hard. She looked up. The room waited. 3 minutes, she said. Let us work. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.